Garza. The briefing will begin momentarily. We will take questions submitted by members of the media after making brief remarks. I'll now turn it over to Dr. Alex Garza.
Okay, good afternoon, everybody, and thank you for joining us for today's briefing. Today, in addition to our regular hospital data, we're going to be covering vaccine distribution and share a few updates about the task force health systems roles in the vaccination process. But before we get to those updates, I'd like to welcome today's guest speaker. Joining us by Skype today is Hudan Abdullahi, who works in nutrition services at Mercy South. Hudan, I'll turn it over to you to talk about the work that you've been doing and how the pandemic has affected you and your patients. So take it over.
Hi there. I think we can start off by saying that we can acknowledge that this past year has struck the world in an unprecedented way. There have been a lot of firsts in just this one experience. I remember watching the news daily to see when things would get better. And I also remember the seriousness of COVID being played off as nothing more than an alternative flu. And then all of a sudden we had this major world lockdown. And that's kind of when it clicked that this was something different. And the stress of not knowing when things would get better was immense. Everything just seemed to really be getting worse. And overall, it was just something I wanted to end. So that's what the COVID shot really means to me. It's the beginning of that end. It's where we can all build our way back to a normal, to a safe place that we can understand. When I think specifically of the COVID shot, I think of my father. You see, my father's in an endangered class of people. He has type 2 diabetes, and he tries his best to keep it under control, but he never can really do. So I know that if he was to get sick, he would struggle more than the average person in order to get better or even just to stay alive. So over time, I watched him become consumed by this pandemic. He would follow the news every day about the ventilator shortages. He would sit there, just keep track of the death toll. And I can just see the panic eating away at him. Even within the safety of our home, I watched that fear take a mental toll. So really, that vaccine, it lets me protect my family by showing them that there is a way to protect yourself. It helps ease that sense of hopelessness. Because I know that if my father was out at a grocery store, I would want everyone to have followed all the established safety guidelines. I would want them to have their masks on. I don't want them to be there if they have, any signs of COVID. And ideally, I would want them to be vaccinated. And if I want that for my own personal benefit, I need to be able to do that for others, strangers or not, because everyone is someone's loved one. I mean, everyone is someone's mother, father, brother, sister, and you don't know what their road to recovery would be like if they had COVID. So you have to treat others the way you want to be treated and the way that you want your loved ones to be treated. And getting the vaccine let me do my part for myself, my family, and my community. I know there's a lot of misinformation with the vaccine, but I feel like Mercy is an organization that tries its best to provide factual information in order for individuals such as myself to make informed decisions about our bodies and our health. After my first shot, I really didn't feel any symptoms at all. My second shot came with just a sore arm, but that lasted about a day. But I was prepared for a greater immune response, especially with that second shot, because I knew I'd rather risk that than to get COVID. It's like the difference between the big blue sea and the clear blue sky. You have to pick what you want to experience. Although they might seem similar in their unpleasantness, I knew that there was a clear and obvious difference. At least to me, I knew that I would rather get sick mounting a defense against COVID than to actually get COVID. After my vaccination, I noticed that I have a lot more confidence whenever I'm talking to my patients directly, and whenever I'm doing patient rounding or when I'm speaking to them about their food and nutritional needs. I can make sure that they are at ease because I know that I put them first because I've been vaccinated. It's also important to look at how fortunate I am. I know there's people who are desperately searching for the opportunity that I had, and they are placed on a wait list for months at a time, and they don't know when they will be chosen. I know that they're kind of stuck in this limbo, and it's something that I don't really have to worry about. And for that, I'm truly blessed because I have been given peace of mind. Thank you.
Great. Thank you, Hudan, both for the work that you're doing and for taking the time out to come and talk with us today and share your story. I really appreciate it. Sure. And good luck to your father as well. Thank you for that story. Okay, we're going to go ahead and move on now to a little bit of information about vaccine distribution. So let me start with a little bit of context about the supply of vaccine that is coming into the region. So as many of you know, each week, every state in the country is issued COVID vaccine from a federal vaccine supply, so both from Pfizer and from Moderna. The state then allocates this down to the local levels. That includes hospitals, local public health, other health providers, federally qualified healthcare centers, places like that, and that supports the regional vaccination efforts. So let me share a little bit of data with you about where we are today. So on any given week, the state of Missouri receives around 76,000 doses per week. Now, of that, and you may have heard this from the governor's press release, which was on Monday, about 53% of those vaccines are going to be going to what's called high-throughput healthcare systems that are located around the state. And now there's 9, and the way that they've divided this up is to 9 different highway patrol regions. So the remainder of that vaccination, then 23% of that is going to go to the National Guard to do mass vaccination events. The plan is to have a mass vaccination event in each of those highway patrol regions every week. The remainder then is divided between local public health, federally Now, if we look at Region C contains around 11 counties plus the city of St. Louis. The population of Region C is rather large for the state. In fact, it's about 37% of the total population of the state resides in Region C. Now, we were informed that we will be receiving around 15,600 doses every week for those high-throughput healthcare systems for this Region C. So as you can imagine, that number of doses then gets stretched especially thin. Now, so using that as a backdrop, now let's talk a little bit about who is eligible to get vaccine. So we've talked in previous briefings about the population that is now eligible, and I'll stress the word eligible. The amount of people eligible for vaccine right now is much, much larger than the supply of vaccines that's currently available. Now, remember who is currently available. So it started off with that 1A population, which was healthcare workers, long-term care, nursing home, both residents and workers. And we believe that we're getting close to finishing up that population. Next is that phase 1B tier 1, which by and large is mostly those first responders, some public health, and some healthcare individuals as well. Now, once we get down to the phase 1B tier 2 is that really large population that we're talking about. And I'm going to show you some numbers here in just a second, just so you can get a good idea on the size of the population that we're talking about. And remember, the state has designated these as persons that are 65 years of age or older, or if a person is 18 to 64 years of age with an underlying chronic condition. And you can see what those conditions are on the Missouri Health and Human Services website. So our goal as healthcare providers, so as you can see, with 15,000 doses, it's going to be incredibly difficult. Now, as I said, we're getting close to finishing up that 1A population. The 1B tier 1, we're also working on right now. So you may have seen some footage on the national media of us vaccinating our law enforcement personnel, first responders, other people that are in this tier 1 population. And so we are getting closer and closer to finishing those out. But just remember, we're still cleaning up those populations, or we're still finishing vaccinating those populations. So when you get to tier 2 now, that's where that large percentage of population comes in. So let me just share a couple of numbers with you. And so this is what we're looking at when we're talking about these populations. So the state picture on the left-hand side of your screen is patients that are 18 to 64 years old that have one of those chronic conditions that are listed on the state's website. And this is from claims data, and so it's a little bit of a conservative number because it's all of the persons that have had an insurance claim filed that we're able to find. And this comes from the Missouri Hospital Association, who did this analysis. So in looking at the numbers for Region C, there is approximately 316,000 people that we believe would fit within that category. Now, when you look at census data, so our analytics team then went out and started looking at census data and looked at this by each county within Region C, and then we were able to sum all of those numbers together to come up with a broad idea on what does the over 65 population look like. And as you can see there, it's around 385,000 people. And that's from the 2019 census data. So this is just to give everybody an idea of the magnitude of the population that we're talking about that needs to get vaccinated in this 1B Tier 2. So putting this all together now, the eligible population versus the vaccination amount, I think you can appreciate what the challenge is. So if we have around 700,665 persons that we've identified as fitting within the eligible population, and we're receiving around 15,600 doses a week, you can easily do the math and see how long it's going to take us to get through this population. Now, we know vaccine production is most likely going to increase, that we will be getting more vaccine as time goes on. If that Johnson & Johnson vaccine does get emergency use authorization, that's more vaccine that's going to be coming into. But the reason why we share this with you is because it's taking a while to get through the population, and we understand that people are concerned and frustrated if they are in the eligible population but are not receiving vaccine on a very timely basis. There's a reason for that, and that's because of vaccine scarcity. Now, because we have such a small amount of vaccine, given the population that we have, the healthcare systems have to then think of who is this going to help the most, or who do we need to protect the most, given a very scarce resource. And so when we've looked at the data that we've gathered throughout the pandemic, one of the benefits of this task force is being able to collect all of our clinical data and then start to look at who is the population that is most affected by COVID. And by that we mean who gets admitted to the hospital, who has to go to critical care, and unfortunately who ends up dying from COVID as well. And then we can use this to prioritize our vaccination schedules so that we can make sure that we are decreasing morbidity, so illness, and we're decreasing mortality, so death. Those are the goals that we have. So currently, the St. Louis healthcare systems are focusing on those populations that it's going to affect most. And that includes those persons greater than 75 years old and patients with other things such as active cancer or solid organ transplants, because they are severely immunocompromised. And so if they had COVID, it would affect them the most. Now, we're also working with our partners as well as within our own systems to make sure that we're addressing that equity question as well. And I'm going to show you a slide looking at our breakdown by race. And the reason for that is the population distribution is different according to race. And we'll talk about that here in a minute. But nonetheless, in addition to looking at age, we also have to look at equity. And we'll continue to share updates on our vaccination progress as we go through this and let you know how we're doing. But I just wanted to show these numbers to you just to share this is the task that's at hand. And it's enormous and it's challenging, but this is the task that we have, and we have to make sure that we're protecting the most vulnerable. So again, this is just to reiterate where we are with the schedule. Almost finished with that phase 1A. Still working on that 1B1 and starting that 1B2, but it'll take us a while to get through that 1B2 unless vaccine production picks up. I wanted to talk a little bit now about who has received vaccines so far. So to date, the task force hospitals have received or administered about 197,071 total doses of COVID vaccine. And this is data that we pull from the state's data system, the Show Me Vax data system, where everybody has to enter data for who they've vaccinated. So this data was pulled yesterday, so it's up until, and it's about 2 days lagged, so it's a couple of days lagged right now in our data. Also wanted to start reporting doses administered by race. And so as you can see from this diagram, the majority of persons who have been vaccinated so far are white, so it's around 69%. Around 8% were identified as black within the database. Now there's a couple of caveats with this data though that we have to make sure that we understand. The majority of this data reflects that 1A and that 1B1 population, because remember, that was the concentration early on in the vaccination strategy. So the vast number of vaccinations reflect that population, not the general population. We have only recently begun doing the 1B2 population, so more of the general public. And so that's a very small contribution to this pie chart. Now, we believe as time goes on and we start collecting more data from the public, that these numbers will change. But knowing how these vaccinations are distributed by race, which has been in the national media and it's been in the CDC's newsletter here recently, is important because we all know that the African American community is disproportionately affected by COVID. And that is something that we want to be transparent and accountable for to the community as a task force system. Our biggest vaccinators in the region are our healthcare systems, but also our federally qualified healthcare centers and public health also contribute to this, also contribute to distributing vaccine to the community. And so we are working together to make sure that we are addressing that equity lens in vaccine distribution. It's becoming a little bit more challenging given the scarcity of vaccine, but we are coming up with a plan on how we can make sure that we address this because it is important to address. So if you haven't already, and if you fit within one of those eligibility categories, we're asking you to pre-register for vaccine with the health systems or with the public health departments. And the reason is that we have to be able to know who the population is, the total number of people. And we recognize that people sign up on multiple different websites, and that's okay. We'll eventually figure that out, and we'll be able to adjust our scheduling. But it's important for us to know what that total number is. And so what we've done here is listed our websites, and they can be found on our Facebook page as well. So that you can then go there to these different websites and get pre-registered. And from there, we look at the information and we make sure that we're scheduling according to who is most at risk for COVID-19. Again, because we have such a scarce resource. But again, this helps us to understand the population and helps us more effectively schedule so that we can get our most vulnerable populations taken care of. So let's move on now to our regular data that we share with everybody, the hospital's data, and it's still looking good. So some good news to report. So we had a couple of days where our admissions popped up a little bit, up into that 60s range, but now they've come back down into the 50s again, and so that's good news. So we're reporting 52 admissions today, and remember these are lagged by 2 days, and our 7-day rolling average is 61. Looking at our hospital census, that continues to decline as well. Today we're reporting 419 patients in our hospitals with COVID-19, and the rolling 7-day average is 468, which again, all good news because it's all pointing down, so those are all good numbers. A little bit more detail now on our COVID-19. So these are people that are tested positive for COVID-19. As I said earlier, 419 patients in our hospitals today, 82 patients in our intensive care units, and 59 on ventilators today. Looking at our suspected COVID patients, and again, those continue to come down as well. Today we're reporting 28 patients with suspected COVID in our hospitals, 3 in the intensive care units and 2 on ventilators. So it's nice to see those down into those single-digit numbers. Our good news slide for today, discharged 90 patients yesterday, bringing that cumulative total to 18,176 patients discharged from the hospital. And again, a big shout out to all of our healthcare practitioners, our guest speaker today, and everybody else that is helping these patients get better and being able to go home. Unfortunately, we're still seeing inpatient deaths from COVID as well. So today we're reporting 9 deaths that occurred yesterday, and our rolling 7-day average is 8. But again, it's nice to see these down into the single digits. And again, we just include this slide to make sure that everybody, again, correlates the deaths back to admissions and then back to cases. If we want to decrease deaths, then we have to decrease cases on the front end. So even though I've talked about vaccine a lot earlier in the presentation, I also talked about how scarce they are. And so what does that mean? That means that we have to continue doing all of the things that we've been talking about up until this point, which is wearing masks, staying socially distant, not gathering in groups. So don't forget, just because we do have vaccine coming, still very small amounts, we still have to be doing all these other things to protect ourselves. I will finish up here by again showing the websites where you can pre-register for vaccine with each of the healthcare systems. If someone in your life, a relative, a friend, or neighbor doesn't have access to the internet, please help them get registered. Now, once you have pre-registered, we ask that you be patient while we schedule you for your vaccination appointment. And like I said earlier, we know that waiting to be notified that it's your turn to be vaccinated is extremely frustrating and difficult, especially after everything that we've been through for the past almost year. And especially when you're worried about your health and your loved one's health. But there's still a lot we can do to make a difference. While we wait, there's a lot of control that we can have over the virus until we can get vaccinated. Keeping those things that we've been doing this whole time, wearing a mask, washing your hands, social distancing, all of those things will help control the virus. Now, the vaccines are going to help us end the pandemic, but we still have many months and many millions of vaccines to distribute before that happens. So in the meantime, we need everybody to be doing their part to save lives. So again, apologize, it's been a long briefing, but we're going to take some questions from the media now.
While coronavirus numbers have been moving in the right direction recently, how concerned should we be about new variants of the virus, and will current vaccines be effective against the new variants?
Let me start with the second part first. So there is efficacy against the variants. Now, it isn't as efficacious, meaning it doesn't work as well in plain language, with those variants like the UK variant and the South African variant, than the one that is more predominant, the one that's circulating right now. That doesn't mean that it doesn't work, just doesn't work as well. And we don't know, what does that mean? Does that mean that people will become sick enough to have to come to the hospital? Or does that mean like they just feel worse when before they may have been asymptomatic? Just don't know that yet. So the second piece, though, I think is the more important piece, and that is the worry that we have is that if people start seeing the numbers trending down and then falsely believe that now we're out of the pandemic and we don't have to do all of the mitigation strategies, such as wearing a mask and social distancing and gathering in groups. That's absolutely the wrong message to take away from these declining numbers. So, the perfect storm would be people relaxing the mitigation strategies as these other variants that are more transmissible get a hold. Because now you have less of, you have more risk of of being infected, so you have, more opportunity to get infected if you don't practice those things. So it's even more important now than previously that we follow all of those mitigation strategies because these variants can be more transmissible. So there's little room for error now as these new variants make their way across the country.
For people who have been vaccinated, can they still contract and pass on the COVID-19 virus? And why is it important for people who have been vaccinated to continue to wear masks and practice social distancing?
So there isn't a lot of solid science on this yet, but there is a biological plausibility that people that have been vaccinated can still become infected and transmit it to others. So what do I mean by that? When the vaccines were evaluated in the clinical trials, the endpoints were, did a person get severely sick or did they die from COVID-19? There weren't tests done to show, did somebody get infected, not know about it, so didn't develop any symptoms, which then allowed them to transmit to somebody else. So remember, about 40% of people are asymptomatic, so they don't have any symptoms at all. So it is possible for somebody to have gotten vaccine, not developed severe illness, but still been infected and able to transmit it to somebody else. Now, the recent news about I believe it's the AstraZeneca vaccine, that showed a decrease in transmissibility as well. So it didn't go down to zero, though. It was just a decrease in transmissibility. It is really the first evidence that we have for vaccines and how they affect that. And I would suspect that the Pfizer and the Moderna probably have the same effect, but we just don't know. And so that's why it's still important for everybody to continue to wear a mask, social distance, all of those other things, even if you have been vaccinated. And then the second point is a little bit more maybe philosophical. We shouldn't be dividing up our society or our community into people that have been vaccinated and that have not been vaccinated. And so it's important that we're all in this together and that we all do the same things, wearing masks, socially distanced, regardless of your vaccination status.
Can you provide guidance on any benefits gained from wearing 2 masks?
Yeah, so there's still some ongoing science about this, and so I haven't seen at least anything recently that's been published about the 2 masks recommendation. So from a theoretical point of view, if you're wearing 2 masks, then that increases the filtration for aerosols and droplets, which is the primary mode of transmission for COVID-19. And so just from the pure physics of it makes sense. But I have not seen any sort of more formal studies that have been done to say, yes, it decreases by this amount. But just logically, it would decrease the number of particles that you would inhale if you were wearing 2 masks. Now, obviously, there becomes a rate of limiting return, so that doesn't mean that it doubles your protection, and if you wear 3, it triples. It's just added, and of course, everything is dependent upon context as well. So if you're wearing a single mask while out walking around, probably fine. If you're going to be in a crowded place where there's a lot of people and there's not a lot of ventilation, 2 masks probably make sense. So there's a lot of different things I think you need to think about when considering the 1 mask versus 2.
Has St. Louis seen so-called vaccine chasers, people who basically wait in standby lines for any unused vaccine at the end of the clinic? And what are your thoughts on the practice?
I have not personally heard of that. I think I've seen a little bit of it on the media, but I have not heard of it anyway from any of our providers that this has been happening. There have been some attempts to do walk-in, so walking into one of our vaccination clinics and expecting to be vaccinated. There were some scams going on the internet saying, yes, we're doing that when we're not. So I think it's happened, here and there. I haven't heard any wide-scale issues with that. I would recommend people not to do that because then it distracts our vaccine workers from doing the jobs that they need to be doing, which is vaccinating the scheduled public or scheduled patients. And as I spoke about before, we want to make sure we're getting the most vulnerable population, and so it distracts from our personnel trying to get through their jobs. We have processes in place where if we do have sort of a no-show and we do have some leftover vaccine, we have a backup call list that we can bring people in that are on the list to get scheduled. So no vaccines are going to waste. There is a process on how we deal with any excess vaccine. So it doesn't help to, hang around outside the vaccine clinic hoping that there's going to be an extra dose somewhere.
We've been in the pandemic for about a year now, and we continue to see people getting lax about wearing masks. What recommendations are you making for folks now that spring break is just around the corner?
Same ones I've been making for close to a year now. So, need to continue to wear masks, need to continue the social distancing and not gathering in groups. It's in spring break is no different than Christmas break. It's no different than Labor Day, Memorial Day, all of those other, days that we typically, think about gatherings and travel and things like that. So, again, it's not a normal spring break. It's a spring break in a pandemic. And if you remember, it was about a year ago over spring break when the pandemic really took off, and many people had to cancel their plans for spring break. And so we're still in this pandemic. We still have a large number of patients in our hospitals. We still have a large amount of virus circulating. So this is no time to let up on any of those strategies.
The governor announced yesterday a new federal program giving Walmarts and Health Marts vaccine. Is this a positive step into getting more vaccine into the region?
So it's a positive step in getting more vaccine into arms. So anytime that we can increase the number of vaccine that we're getting into the state and the ability to vaccinate people is a good thing. Now, with that being said, I don't know what the penetration of Walmart or Health Marts are into our region. When I say about our region, I'm talking about Region C now, because that's how our doses are allocated. From my understanding, we don't have a large number of Walmart or Health Mart stores in the immediate metro area, so St. Louis City, St. Louis County. And so what I would want to make sure that this is considered is as those doses and as those vaccines go into those areas with a high penetration of Walmart, that we adjust the other vaccines then to make up for that difference. And so if we have few Walmarts and Health Marts here in the Region C area, then that should be counterbalanced by more vaccine from the state's allocation coming into our region.
What's your biggest concern right now and moving forward?
It's a vaccine amount. And I know the majority of this is out of our hands. So we can't manufacture vaccine. So we have to rely on the vaccine manufacturers to pick up the pace on that. The things that we can control are the populations that we vaccinate, so protecting our population. And then the other things that we control, which is probably even more important given the scarcity of vaccine, is protecting ourselves by using the mitigation strategies. And so you've already heard me talk about those different variants that are out there. If those get hold and people are lax in not wearing masks or doing all of those other prevention strategies, then we could lose all of the ground that we've gained over the last couple of months. And we could be right back to where we were in that November, December timeframe, and nobody wants that. And so we have to be very cognizant of where we are in the pandemic, the risks that are hovering ourselves by using the mitigation strategy to prevent more spread of the virus. Things are looking better now, but we want them to continue to look better. And the way that we do that is by doing everything that we've mentioned.
That concludes the list of questions received prior to today's briefing. Thanks for watching.